In this lesson, we will be reviewing the process of surgical site prep. Surgical site prep is the process of preparing a patient's surgical site in a sterile and aseptic manner. This is done by clipping a surgical area and then cleaning it with a surgical scrub and a surgical antiseptic to create an aseptic or clear from contamination and bacteria area for a surgery. A vet assistant or vet technician can prepare a surgery site for a veterinarian to perform the actual surgery. Prior to beginning this process, you are going to want to make sure that you properly clip the surgical area. Wherever that incision area is going to be, you want to clip a surgical margin around it that extends 2 to 4 inches beyond the anticipated incision borders. You will usually clip with a surgical clipper blade about a number 40 or 50. You're going to want to apply an antiseptic scrub to the clipped area. Examples of an antiseptic scrub could be a chlorhexidine scrub or even a betadine solution. To prep that clip area, you're going to use a clean sponge. You will begin at the incision site and then move in a circular motion, working away from the incision site or towards the edge. Once you have left that incision site, you do not want to bring the sponge back to the incision site. Once you have completed that, you will discard the sponge once it has reached the edge of that clipped area. Using a new sponge, you will wipe the clipped area with a rinse solution, using that clean surgical sponge and following the same pattern as when scrubbing with the antiseptic. So once again, starting at the incision site and working in a circular pattern outwards to the edge of the clipped area. Examples of different types of solution that you could use would be a chlorhexidine solution or even a rubbing alcohol. You will repeat the scrub and rinse a minimum of 3 times or until the final rinse sponge is clean.
Hi, my name is Courtney Jones. I'm a registered veterinary technician, and today I'll be properly demonstrating how to prep a surgical site. To start, I will make sure that my area is shaved and ready for me to start prepping. With my antiseptic solution, most commonly you'll be using either a chlorhexidine scrub solution or a betadine. So I'll be using a chlorhexidine solution today. So with my patient on his back, and we can see where the incision is going to be. And so starting at the incision, I'm going to clearly clean that incision and then make a circular motion until I reach the edge of the clipped area. And I'm going to continue this at least 3 times or until my sponge comes back clean. So we can see that my sponge is already coming back clean, so I'll make sure I do this a minimum of 3 times. And when I'm going over this in a circular motion, I want to make sure that I'm not going back to the incision site after I've cleaned the rest of the area. And so after I scrub with my antiseptic, I will then scrub with a solution in the same pattern. I'm going to properly demonstrate how to prepare a surgical site. To start, I'm going to apply an antiseptic scrub to the clipped area. I'll prep the clipped area with a clean surgical sponge, beginning at the incision site and moving in a circular motion, working towards the edges. I make sure that I do not bring the sponge back to the incision site once it was moved away from the incision site. I will discard the sponge once it reached the edge of the clipped area. I want to make sure I continue this for a minimum of 3 times or until the final sponge was clean. I'm going to wipe the clipped area with a rinse solution using a clean surgical sponge, following the same pattern as when scrubbing with the antiseptic. And again, I want to repeat the scrub and rinse a minimum of 3 times or until the final sponge was clean. And the pet is now ready for the sterile procedure.
In summary, to prep a surgical site, you will apply an antiseptic scrub to the clipped area, prep the clipped area with a clean sponge, beginning at the incision site, and moving in a circular motion and working towards the edges. Do not bring that sponge back to the incision site once it is moved away from the incision site. Discard the sponge once it reaches the edge of the clipped area. Wipe the clipped area with a rinse solution using a clean surgical sponge, following the same pattern as when scrubbing with the antiseptic. Repeat the scrub and rinse a minimum of 3 times, or until the final rinse sponge is clean.